Nathaniel, it means given by God, and he came into this world as a gift to us to save his brother's life. I knew he was a match. I just knew it. I can't explain that, I just did. And he brought with him life, not just his own. So it's amazing.
In April of 2002, 2 months after Nathaniel was born, Nicholas began an intense course of radiation and chemotherapy to destroy his cancerous cells and pave the way for the transplant.
I remember the day they brought the cord blood. A lady in a long white lab coat came walking down the hall with a little cooler type thing. And I was amazed when I saw it. There's my son's life. That's a central line, goes into his heart. There's the stem cells.
And here's
this is where I was so nervous, when she's pushing the air out, and I was just, you know.
One false move, there it goes. Don't lose a drop, not one drop.
And that's it. Nathaniel's stem cells going into Nicholas. In the hospital, when they do this with the patient, they do a birthday celebration for like a new birthday. It was an awesome day. I always tell Nick that, you know, we got you twice, when you were born and the day you got your brother's cord blood.
You happy? Yeah. Hey, Nick, welcome home.
Within 2 weeks, the stem cells from Nathaniel's cord blood began rebuilding Nicholas's immune system. His white blood cell count began to climb.
It's hard to think sometimes when you look back at that little thing of stem cells that that's going to do what it did. And there were dark days, and we feel like we were pulled out of an abyss. Stem cells saved our son's life.
Today, Nicholas is cancer-free. He is off all medication and has recently started school.
I can't take my eyes off of Nicholas. I want to see every move he makes on the playground. You know, I want to see everything he does. You know, he's like a normal kid. For so long, he wasn't, and now it's life, you know, and they both have life now, and it's just amazing.
Tell us what the weather's like. Tell us what the weather's like. Nicholas says it's a sunny day. Monday is a sunny day.
Treating lymphoma with bone marrow stem cells is an established therapy, but doctors are now trying to put these cells to other uses. Here in Germany, they are being used to treat the #1 cause of early death in the Western world, heart attacks. At Frankfurt's leading teaching hospital, cardiology professor Andreas Zeyer is running an experimental trial for severe heart attack victims. He hopes to repair patients' hearts by using their own stem cells, stopping their slide into disability and avoiding the need for high-cost medical care.
What happens during a heart attack is that the cells die within an hour, hour and a half after being deprived from oxygen, and this finally results in scar formation of the heart. That means those dead cells are like a scar on your skin. They do not contract, they do not contribute to the pump function of the heart, and if your heart attack compromises more than 40% of your left heart, then you will go into severe congestive heart failure. And it simply eats up your body. It does not allow you to exercise. You have difficulty climbing stairs. Then you feel that you cannot breathe at all. You are almost going to die. And their 2-year survival rate is less than 60%. So it also has a very, very bad prognosis, comparable to the most aggressive cancer.
Dr. Zeyer believes that a low-cost, outpatient bone marrow self-transplant may be the solution. 41-year-old Thomas Gertz had a major heart attack in January 2003. 6 months later, he underwent the transplant, and his heart soon returned to 2/3 its normal pumping capacity. Now Gertz is back for a second transplant, hoping for even more improvement.
2 months ago, he received almost 200 million bone marrow-derived cells. I would assume that less than 3% of these are actually stem cells. And as long as we don't know which specific cell type is the most potent stem cell for cardiac regeneration, we use all the bone marrow cells we can get.
The operation begins with a tiny incision on the inside of the thigh to access the femoral artery. This enables the doctors to feed a balloon catheter into the left side of the patient's heart. Once in place, the balloon is inflated to gently widen the blocked artery that caused the heart attack. The catheter can then be used to deliver the bone marrow stem cells into the damaged heart. Widening the blocked artery is standard therapy for heart attack victims, but the stem cell transplant is new.
We still don't know why the heart can't repair itself. I think it's part of that aging process that may mean that the stem cells are not as active as they should be, and we're trying to concentrate them where they're needed to increase that activity. Patients understand this instantly. It's not complicated. They'd like to use the natural processes of their body to heal themselves, and this is more appealing than having some foreign chemical coming into their body. When you're taking your own bone marrow, there's absolutely no danger to you as the patient, so it's a great advance. Cell therapy is safe therapy.
Also sieht sehr gut aus, Sie haben ganz... Okay, here we go. We have now the balloon right where we want to have it. And here we have 36 million stem cells. And now we give the cells.
As the cells are injected, blood flow to the damaged portion of the heart is temporarily stopped. Unfortunately for the patient, this feels like the heart attack has returned.
Now blood flow is entirely blocked. This is actually an artificial heart attack. We do have some ECG changes, and I think he starts to feel something now. Spüren Sie was?
Ja, ja.
So the feeling comes again. It's this typical heartburn right in the middle of the chest. It goes into the left arm, left side of the face. And this period of infusion normally causes pain. Tut weh, gell?
Ja.
The bone marrow-derived stem cells accelerate and enhance the healing capacity of the heart simply by releasing substances, vascular growth factors, which attract other stem cells which circulate in the blood. So it's an ongoing cascade of repair. We try to keep it for 2.5 minutes to give the cells time to adhere before they are washed away by the blood. But if patients cannot stand it, we stop. It's not a very pleasant feeling. It's really that you feel you're in danger of your life. Stimmt das? Fühlt sich doch wirklich äußerst unangenehm an, oder?
Ja.
So we stop after 2:30. So the pain quickly disappears after we deflate the balloon and let the blood flow restore oxygen supply to the heart. And now the ECG is already normal. Ist es besser jetzt?
Ja.
Ganz weg?
Ganz weg noch nicht. Ja.
Sie haben noch leichten Druck.
The pilot study for this therapy, published in December 2002, involved 20 patients. They all showed an improvement in heart pumping capacity 3 times greater than that from standard treatments.
What we can do is we can measure how the heart squeezes the blood. Every single patient in the pilot study had an improvement in how that pumping occurred, which is unusual for a trial because biology is so complicated. Some patients get better, some patients get worse. In this pilot study, everybody got better on the quantitative analysis. This rates as a very non-invasive therapy. And it would require very little expense, very little organisation to get it into mainstream clinical practice. And it will have a major effect on millions and millions of people around the world.
300 heart attack patients have now been treated with their own bone marrow stem cells. The oldest was 84. Wolf Makowitz is a 40-year-old patient from the original pilot study. He had a massive heart attack in September 2002 and was briefly on the heart transplant waiting list. Instead, he received the stem cell transplant and is now at the hospital to find out how his heart has healed.
And how do you feel now?
Quite well. I have no problems whatsoever.
I can just show you what this therapy actually does. This angiogram simply shows the pumping function of the heart. This was before treatment, and I think it's very obvious. In this area here, the heart is perfectly contracting, as we say, so it's moving inward, and therefore blood is propelled outward. But in this area over here, there's almost no movement inward, so no pump function at all. And this is the scar damage of the heart attack, which does not pump anymore and thereby does not contribute to the expulsion of blood into the body. And this is what we find after 4 months. And now you see that the scar area is almost completely gone. You see a perfect inward movement of the heart over here, and therefore the expulsion of blood is much better. This we would regard as a completely normal function of the heart.
Okay.
So there's no residual state after the heart attack.
This is the beginning of a sea change in medicine, whereby we understand these cells, we find more types of them, and we understand their importance, not only in repairing damage, but also in the aging of the body, and stopping the aging of the body generally.
I now have a completely normal life, not like other heart attack victims. And for the first time in my life, I'm exercising, walking and jogging. I feel like I can do anything again. And this is really a great experience. I didn't expect that to happen.
There's no doubt that this is going to be a mainstream therapy, definitely. So we have, for the first time in our life, some kind of regenerative therapy for, in quote, a broken heart.
While still experimental, the life-saving potential of this therapy was demonstrated last year. Paramedics received a call that a 16-year-old Michigan boy had been shot through the heart with a nail gun. The victim later described the shooting at a press conference.
My boss, he has a 20-year-old son. He was, I guess, kidding around, and there was a nail gun in the room. And we were just working, and he picked up the nail gun and asked to shoot me in the foot. And I said, shoot yourself in the foot. And he kind of like pointed it at me. And I was running around the room, and he popped me in the chest real quick, and then I just fell down. It was just like someone had knocked the wind out of me.
It was quite fortunate that the nail was in his heart, because if the nail had been removed, he probably would have died. The nail was actually preventing him from bleeding to death. There was a chest x-ray that was done when the patient came into the emergency room, and you can see that the nail is actually sitting right here. It's going through the chest. It's 3 inches long.
Dimitri's heart was so badly bruised, he suffered a series of major heart attacks.
1, 2, 3.
The damage to his heart tissue was tremendous.
The whole front part of his heart is not working. You can see that this part is normal, but all of the front part and the tip of the heart is not moving at all. Just really no function. In addition, we did an MRI study, and that showed that the entire front portion of Dimitri's heart was entirely dead. 2/3 of the front and tip had no blood flow going to it, and that all would have ended up as severe scarring that, if he would have survived, would have left him crippled for life.
It looked like Dimitri's only hope was a heart transplant. But even with a new heart, his life expectancy would only be about 10 years because of the effects of the anti-rejection drugs. Dimitri needed a better option.
We were aware of the regenerative therapy that was going on in Europe, Dr. Zayer's work. We tried not to oversell it, but we really had nothing else to offer him, and we were honestly trying to prepare them for the worst.
He just had really limited options, besides maybe potentially having a transplant at the very worst scenario or even dying. We felt that it was a very low-risk, high-reward scenario for Dimitri.
Dimitri's young age helped with the decision, since stem cells are most vigorous early in life. The doctors filtered the cells from his blood, then transplanted them into his heart using the same procedure as in the German trials.
Yeah, it looks fantastic. Really had a great result.
I've been taking care of Dimitri ever since, and I see him every few months. I've never had a patient like Dimitri, both in terms of his youth, in terms of his otherwise good health, and I think that we were really pessimistic about his outlook at the beginning. But he has been doing very well. He's been recovering. Just recently, I allowed him to go back to school. I gave him unrestricted activity, which I think is a great victory. This allows him to engage in sports and basically carry on life in a normal fashion. Dimitri is a snapshot of the future. I think that the potential for stem cell therapy, not just for heart patients, but for all patients, is mind-boggling.
If such therapies are successful, they could require less follow-up and be cheaper than traditional treatments.
Dimitri's never had any of the usual complications of heart attacks that we would expect. He didn't need heart drugs, he didn't need water pills, he didn't need anything really to support his system, and he never had any severe rhythm abnormalities of the heart. I've treated thousands of heart attack patients, and I've never seen that kind of level of improvement in any patient before.
Dimitri's recovery provides hope for cardiac patients worldwide, because his own cells restored the pumping capacity of his heart. Doctors measure this capacity using a ratio called the ejection fraction.
Normal ejection fraction is 50%, so when he started, he had an ejection fraction of 15%. After therapy, it went up to 45%, and we're cautiously optimistic that when we repeat studies at a year's time, that he may actually return to normal function. The underlying cause of the vast majority of the symptoms that heart patients have are related to problems with the heart muscle pumping function. If we can fix that pumping function, then people will really basically go largely back to normal.
The main pumping chamber of Dimitri's heart was 2/3 destroyed by his injury. His doctors believe the stem cells healed it in a revolutionary way.
What we suspect is that the stem cells have floated to that area and have grown new cardiac cells. That concept has just completely flipped cardiology on its head. It just has revolutionized the way that we think about the heart and treatments for heart problems. Worldwide, millions of patients could benefit from this. Certainly for the Western industrial countries, this has dramatic promise.
The spinal injury patients are also optimistic. 6 months after her surgery, Kim Gould is back at home and fully recovered from her stem cell transplant. Her legs are still paralyzed, but she is working hard at her rehab and seeing some early signs of improvement.
Still very early days, and I'm not stupid. I don't think, wow, it's just going to come back just like that. But I have noticed a difference in my lower back muscles and my lower abdominal muscles. Just the way I move and hold myself, I do feel it is a bit stronger down there. And that just gives you hope that it is all knitting together, and it's just waiting to see what you're going to get back out of it now.
I want you to tighten up your muscles and help me raise. All right, ready?
A year after her transplant and still doing intensive physical therapy, Laura Dominguez is continuing to amaze her doctors. After 2 years of paralysis from the chest down, she is regaining sensation and muscle control in ways that shatter normal expectations. Like a baby learning to walk, she is flexing her foot and pushing out her toes.
Good. Try one more for me.
Her continued recovery is an inspiration for Dr. Lima's other patients, like Joy Varon and Susan Feit.
I was just trying to get my foot to move in any way that it could, even if it was just a little flicker. And I did it. It happened, and I was really surprised. And then I started thinking, well, if that can happen, then I can definitely get some more movement back.
Push it, push it. Come on, push, push. Good.
I was excited. I wanted to keep doing it and make it stronger.
Raise force at the end, all right? On the count of 3, ready? 1, 2, 3. Good. Just relax, Laura.
The first time it took like 3 or 4 people to help me stand up just to make sure I wouldn't fall. It was pretty wobbly.
Good.
A month ago, I could only stand up a few times and I was really tired. I was beat. And today I stand up 30 times, 10 seconds each time.
Let's go.
And now when I stand on my toes.
Come on, Laura, push.
Laura's results herald a stem cell future that may revolutionize medicine as we know it. But there is still much to be learned about these miracle cells, and only time will tell if they are all we hope them to be.
Ready? Come on, Laura. Push. Good. Okay, come on back down.
Since I got the push in my ankles back, I know that if I can do that, then I can do a lot more. I'm going to be the way I was, walking and running and all that.